Well, good morning, Queensland. I can report that we have 4 new cases in Queensland. 2 of those are overseas acquired and in hotel quarantine. The other 2 are locally acquired. They are household contacts of a known case linked with the aviation cluster. They were detected while in home quarantine. However, we're still investigating whether they have spent any time in the community while infectious. But they are young individuals in the household, so it's unlikely they've been to other exposure sites beyond what their parents have. But of course, that investigation is occurring at the moment. We can also report that the truck driver that we said is an animal handler that was on the Gold Coast that we reported yesterday, New South Wales has now advised us that that is a negative positive case, so that's great. So that case is no longer a concern at all. So that brings us to 25 active cases. Well done to Queenslanders. We did 21,194 tests yesterday, and that brings it to over 70,000 tests have been done since the start of this aviation cluster. So thank you for people coming out and getting tested. Of course, across those LGAs of Moreton Bay Regional Council, Brisbane City Council, Logan and Gold Coast, but also Townsville and Palm Island. So please, if you have any symptoms anywhere in Queensland, but particularly these local government areas where we know there's been known cases, please come out and get tested, and we know that you will rise to that challenge because we have seen these numbers increasing every day in our testing. We did 22,395 vaccinations yesterday, so well done for everyone coming out and getting vaccinated. And it's wonderful that we're here today at one of our new pop-up clinics. So I'm at the North Lakes Health Precinct. It is open today and tomorrow from 8:30 to 4 p.m. And from next Friday, they'll be opening up on Friday evenings from 5 p.m. to 9 p.m. We'll be opening from Fridays to Sundays for the next 4 weeks. And we encourage people to come down and get vaccinated. And I know some people have already got in nice and early this morning and have already had their vaccine and are heading off to enjoy their long weekend. I do also want to mention that New South Wales has indicated that it is putting casino into lockdown on the New South Wales border, which means that from 1 a.m. tomorrow morning we will be putting the Richmond Valley local government area that is in that border zone into that higher level of restrictions as a hotspot as well. So please, anyone who is in that area or travelling to that area, be aware of the changes from 1 a.m. tomorrow morning. I also want to advise, of course, the NRL Grand Final, that's tomorrow. We will have vaccine pop-up clinics around the stadium. We had such success last weekend that there'll be 2 locations, one at the north and one at the south entry. The northern side is open from 10:30 to 6 p.m. The Wally Lewis statue end, so I'm sure everyone knows where that is. And the southern side is open from 4 p.m. to 6 p.m, the Milton Road end. So if you get a chance, pop along and get vaccinated before the game, or you can come along and make a booking to come and get vaccinated. Remembering, all of the Queensland Health Community Vaccination Hubs are open for walk-ins from now on. You do not need to make a booking. Even if you have a booking that's already booked in for the next few weeks, you can walk in and get vaccinated now. Just tell them you had a booking and that would be cancelled. If you are due for your second vaccination, again, come in, get your second vaccination, because the quicker you get your second vaccination when it is due, then you'll get that protection. Remembering, it's 2 weeks after you get your vaccination that you get full cover. So I'll hand over now to Dr. Young to just talk about these cases a little bit more, and then we'll hear from the local member, Chris Whiting, about our new pop-up clinic here at North Lakes. Dr. Young.
Thank you very much, Minister. So yes, 2 new cases overnight, but the really good news is that more than 21,000 people came forward and got tested, and we've had more than 70,000 Queenslanders get tested since the start of this cluster. So that is really reassuring. Please keep coming forward, particularly anyone who lives in Portside Hamilton. I really need you to come forward and get tested because one of the cases has been there, and I do need need to see a bit more testing from Portside, Hamilton. But anyone in Queensland, anywhere at any time, any symptoms, come and get tested. So our two new cases this morning are both children of that gentleman I announced yesterday who'd been down in the Gold Coast for 4 days while infectious. So they were in quarantine, but they did have a short period of time, of course, before they went into quarantine. We're double checking that there weren't any other venues that they attended that they weren't at with their father. So there may be some additional venues come through from that. But no other new community cases, which is really good. But now, every single day that we don't have community transmission is another day that more than 50,000 Queenslanders have the opportunity to get vaccinated. We have plenty of vaccine. Please, immediately, if you haven't had your first dose of vaccine, it's really important that now's the time you come forward and get vaccinated. You can go to a pharmacy, to your GP, come to one of our clinics like this one here that's a pop-up clinic this weekend. Just go online, find your closest clinic and attend. And if it's more than 3 weeks since your first dose of Pfizer, 4 weeks for your first dose of Moderna, or 12 weeks for your first dose of AstraZeneca, please come forward and get your second dose, because it's not until you get your second dose that you then have that increased protection, and then it takes another 2 weeks after that second dose. So please, everyone, come forward now, 12 years or older, and get vaccinated. That is the best possible protection. Thank you. That's a very loud bird.
Even the wildlife is happy here in North Lakes. My name is Chris Whiting. I'm the proud member for Bancroft. Welcome to North Lakes. It's increasingly a hub in Queensland of education and health services as well as retail. Makes perfect sense to put a pop-up clinic here. I want to say to people in the area and to locals, the clinic here is open between 8:30 and 4 p.m. today and tomorrow. And even better news, it's open on Friday evenings between 5 and 9. So for all those people who are out this weekend in the region, whether it be at the Westfield at North Lakes or at Costco, drop on down, 9 Endeavour Boulevard, come and get one of your vaccines. Having a vaccine is the right thing to do for our community, for our families, and helps us continue to do the things we love to do. So I encourage people to come and use the opportunity and get vaccinated.
So just to be clear, this is at the North Lakes Health Precinct, 9 Esplanade Boulevard at North Lakes, and it's open today and tomorrow, so please come down. I also will advise, being a long weekend, that all of the Queensland Health Community Vaccination Hubs are doing their normal Monday operational hours. So they're not closed. If they're normally open in your local area on Monday, they will be open this Monday. So you can go out on your long weekend and get vaccinated on Monday as well. Questions?
Minister, can you say that the NRL Grand Final is locked in?
Look, a day is a long time in COVID, but things are looking really positive. To know that we had 5 clusters happening, and the reality is that we have not seen any community transmission beyond the actual workplace and household contacts is great news. But it's reliant on people coming forward and getting tested, so we can see if there is any transmission happening out there and we can get on top of it very quickly. But standing here today, beautiful clear skies after we saw that storm come through yesterday afternoon. It is going to be a glorious long weekend, and if people keep getting tested and vaccinated, we're very hopeful that we're going to have a great weekend.
What's your reaction to the Prime Minister saying Queensland Health has been showered in cash and it's had 18 months to prepare for a surge in cases in response to the Premier's call for extra?
Well, it's really interesting that Scott Morrison, as the Prime Minister of Australia, chooses to comment just on Queensland. The letter that I signed had every single health minister from every state and territory in Australia, of all political persuasions. Every single one of us signed that letter. Every single one of us are saying that we have extreme demand in our hospital systems. We have been doing incredible work over the last 19 months since COVID started. Our staff are tired, they are anxious, and we know that things are going to change when we move into the new norm with COVID circulating into our community. Now, we've been doing everything to plan for this, but there are a whole lot of things that state governments don't control. We don't control whether there are GPs in our communities, whether they are bulk billed, how long their waiting lists are, whether there's other primary and allied health care available, whether there's mental health services being available also outside of our hospital system. We don't control whether someone who should be on an NDIS package gets the package and gets accommodation provided for them outside of a hospital, whether a private aged care bed is made available. Every single one of those things has a ripple effect. In fact, more than a ripple, it has a wave effect on our emergency departments, on our ambulances and on our bed capacity. And every single health minister is saying, we need to have the Commonwealth recognise that we need support as we open up more internationally and also our domestic borders. So why Scott Morrison would be so focused on Queensland when every single health minister has signed that, that's for him to answer.
Minister, just on international travel, at what vaccination rate would Queensland agree to allow vaccinated overseas travellers to complete 7 days quarantine?
So as we all heard from the Prime Minister, his announcement yesterday that New South Wales will be trialling having international arrivals coming back potentially as soon as next month. I presume that any states that are going to trial this, particularly New South Wales and Victoria, would at the very least be ensuring that they are out of lockdown before they have people going overseas and coming from overseas into those jurisdictions. But that's a call for them. But I assume that that would occur after they lift from lockdown, and we don't know when they're going to fully come out of lockdown and be at the same level of restrictions that Queensland are operating under. But it's a trial. We will wait to see what the outcome of that trial is, and we will get on with what we're doing, which is getting our population vaccinated and as much as we possibly can, lowering the risk to have this virus circulating broadly in our community while we get that vaccination rates up.
So it wouldn't necessarily be that 80% threshold?
Look, I have said continuously around the 80% threshold that the model, the Doherty Institute modelling is not just about percentage, it's also whether, as a state, what's the number of outbreaks you've got, whether you are able to test, whether you are able to contact trace and whether you are able to isolate the virus and manage those things. I saw the reference to Bali in today's paper, where people will be able to travel to Bali and back but may not be able to travel to Queensland. Well, can I say, I don't know if anyone wants to be travelling to Bali right now when they recorded 1,693 cases 2 days ago, and the 7-day average for Bali over the last week is over 1,900 cases a day. So I'm not quite sure how many people are going to be jumping on planes to go to Bali when they're averaging 1,900 cases a day. So let's just make sure we look at the modelling, we wait for the evidence that talks about what is a safe opening, but we're getting on with it. We're getting on with vaccinating. We have some of the lowest restrictions in the country right now. People are out holidaying this weekend. They're on school holidays. People are enjoying a long weekend. Businesses are open. People are able to go to the theatre, to the cinemas, to a cafe, to a restaurant, to pubs and clubs, and we are getting on with enjoying our lifestyles and controlling the virus.
I think Australians with family in Bali maybe want to go to Bali.
Of course, but do they want to travel there at the moment with 1,900 cases? I mean, what I'm saying is that this has been put out there by the Prime Minister. He has said that he will join with New South Wales and possibly Victoria and trial international travel. We will wait to see what the details of that trial is and the outcomes of that trial. We have no preconceived idea. We're not closed off to the idea at all. But I think the Morrison government needs to do a bit more planning on what countries are they opening up to. Do those countries have to have low levels of transmission of the virus? What happens if someone who travels from Australia to somewhere like Bali and contracts the virus? Are they going to go into hospital in Bali, or are they going to be transported back to Australia for healthcare? I just think there's questions to be answered, but we're happy to look at how the trial will roll out.
Why was there slightly delayed yesterday in listing the exposure sites for the Gold Coast? Also, in yesterday's media conference, Tourist Surf Club, for example, was listed or personally named as a contact site, and then it has never appeared on the contact tracing list. Can you explain why?
Look, Dr. Young went through in detail about this yesterday. What we do, we actually report right up from 6:30 in the morning any information that we have on new cases. So some jurisdictions like New South Wales cut it off from 8:30 the night before, so you're not aware of anything that's happened since then. We will report as current as from 6:30 in the morning. So that might mean we've literally only become aware of the information in the last hour or so before we're standing up and actually providing this information. Our contact tracers then have to sit down with these individuals and get more detail. The days they were there, the times they were there. Sometimes they're looking at the footage and getting more details. They're looking at the check-in app and actually seeing, was there any of the public there? Does this need to be listed as a public exposure site? Sometimes the public haven't been at any of these sites. It is a business where we know exactly who's been there. We're able to identify them, contact them and put them into quarantine. So it all depends on the circumstances. But look, for 19 months, our contact tracers have done an extraordinary job of interviewing individuals, finding out exactly where they've been, the hours they've been there, get this information up on the website. So we're doing that. They're doing it as quickly as possible. In New South Wales, we're seeing up to 4 days delay in reporting of positive cases and contact tracing. We've had people who have been contacted from more than a week or two after they've been to a site in New South Wales. So I think a matter of hours is pretty good for our contact tracers.
Well, why aren't the businesses being notified? We're hearing reports that they're just finding out by being listed on the website. No one from Queensland Health is actually contacting them, forcing them to then start to panic and call Queensland Health to be left on hold.
Look, as I say, we actually provide information real time when we stand up every morning. So we do announce those sites. We do have Queensland Health who reaches out to those businesses. They're not always immediate because they're working through the list of all the exposure sites. I've seen the media reporting how many exposure sites are going up every single day. So as you can all see, there are a lot of exposure sites. So we will work through that. We welcome businesses. I've had businesses ring me who have said, we're ready to go. We've heard on TV, on radio, we've listed. I can tell you we've already got our list of everyone who's been at our site. We've already shut down. We're already organising our cleaners. So I congratulate businesses that are so proactive that they start taking measures before we even get to reach out to them.
There are so many cases that are starting to creep towards the Gold Coast exposure sites towards our border. With international borders potentially being opening up, what does this mean for those who are trying to get back into Queensland from the state?
Well, again, if I understand what Scott Morrison announced yesterday, he's talking about a trial in New South Wales. So, we are working with Queensland residents who are already in the system, who have travelled interstate, to assist them in coming back as quickly as possible when rooms become available. So I don't see any disruption to those individuals. I think what we want to see out of the trial, because we saw a similar thing happen when we first entered into a bubble with New Zealand, where New South Wales did a trial on their own. What we don't want to see is people flying in from international into New South Wales, but then jumping straight onto domestic flights and going into other jurisdictions. That did happen initially with New Zealand, with the trial with New South Wales. We would want to make sure that those people are doing their proper quarantine period before they jump on any domestic flights.
Dr. Young, can we ask why you're concerned about the port side, please? Is it wastewater or something like that?
No. One of the early cases actually lives at the moment at Portside Hamilton. They normally live in New South Wales, but they're currently at Portside Hamilton. And it's starting to firm up that we think there are 2 cases that were probably the first cases of that aviation cluster, and one of them is that Portside Hamilton person. So I just want to ask anyone who lives in that complex, I know it's quite large, but if anyone who lives in Portside Hamilton in any of that area, if they've got any symptoms at all, now's the time to come forward and get tested. I know we've had fantastic response, over 21,000 people yesterday who got tested, but I'd really like a little bit of focus, not only on the Gold Coast, where we've had all those exposure venues, but also Hamilton.
So the aviation cluster started?
Possibly. There's 2 people who attended work in that aviation cluster, and at the moment we're not sure which of those 2 people is the index case, because the really, really good thing, and I commend that business, is every single person, the 6 people from that cluster, were fully vaccinated. That actually, though, although that's really good and it means risks are less, it makes it harder for us to do our job, because we know that vaccinated people frequently don't get any symptoms at all, or they might get delayed symptoms. So it makes it hard to work out who was the original case. But we're starting to think it was possibly this gentleman who lives at Portside Hamilton at the moment.
Dr. Young, what's your level of confidence today that we potentially avoided another lockdown?
It's too early to say. I desperately hope we have, and I think the response from Queenslanders is absolutely amazing, because here we've seen 6 people get infected at a workplace and they're all vaccinated and they've passed it on to their household members. So we know they've got a virus, they've got the same Delta virus that's circulating in New South Wales, so they're passing it on. But then we've so far not seen it get out into the community, which is absolutely astounding. But we can't hope that that's what's going to happen. We need to make sure that we don't have community transmission, and the best way for that is for people to come forward and get tested. It doesn't matter how mild your symptoms, just come forward and get tested. And if everyone could keep wearing masks. I know as we're coming into this beautiful weather, they're a real nuisance to have to wear, but I believe they are protecting Queenslanders. They are critical. So as soon as you go indoors, make sure you've got one on. If you're outdoors and you can't socially distance, make sure you've got one on. And if you go to any major events at stadiums, cinemas, theatres, make sure you wear a mask the entire time until you're seated and you're having to take the mask off to eat or drink. All of those things make a big difference, and it's clear to see that's why we're not getting some of that transmission that I would have expected.
Dr. Young, the potential large crowds this one weekend concern you?
They do, but again, I'm so thrilled to see people wearing masks. So that is what will make the difference. And also, although in some ways it's sad to see because we're all humans and we like that physical contact with other people, I am seeing that people are maintaining that distance. So it's really, really important that when people get together in crowds, stay home if you're sick. The slightest symptom, you've just got to stay home and not go out and about. But if you are going out and about, wear a mask. That's absolutely vital, unless you're in your own family group and you can maintain that 1.5 metre distance.
Dr. Young, Maria said on Friday that Queensland borders would reopen when it's safe. What do you consider to be safe?
When we've got as many people as possible vaccinated. So I'd like every single Queenslander 12 years of age or older to be vaccinated. I really would. At a minimum, I need them to have been given the opportunity to be vaccinated. And now we've got more and more stocks of vaccine, the opportunity is there. So it's really important. Go to one of the pharmacies, go to your GP or to another GP, come to one of our many clinics throughout the state. They're everywhere. So really and truly, everyone in Queensland, 12 years and over, should be able to get vaccinated. Thank you.
A couple of opposition members are part of a union that's got some links to some pretty strong anti-vaccine views.
Yeah.
Do you think they should be stepping away from that membership?
I absolutely think they should be not just stepping away from those organisations who have expressed anti-vaccination sentiment, but they should actually be condemning any anti-vaccination sentiment. And I know one of those people is the opposition's shadow health spokesperson, Ros Bates. So my question to Ros Bates is, how can she belong to an organisation that is espousing and supporting health workers not getting vaccinated, actually supporting health workers not getting vaccinated, and having this anti-vax sentiment? How can she, as a health worker herself, support that view? And why is it that David Crisafulli, as leader of the opposition, is completely silent on this when so many LNP members are actually members of this organisation?
She claims it's for professional protection, to simply be part of that union, to be represented. She says she doesn't support the, views of everybody in a union to accept them.
No, I don't. No. The reality is, as politicians, we're always held to a higher standard, and we have to lead by example. If those are her views, come out and condemn the organisation for the views that they're expressing publicly, because this will impact on the health workforce. This will impact on public's views and sentiments. It is a time when we need everyone coming forward and getting vaccinated, and to simply say, oh, I'm a member but I don't support their views, is an absolute cop-out. It really is a cop-out. She is the shadow health spokesperson. She should be coming out and condemning that position and distancing herself. And if she doesn't, David Crisafulli should be doing it for her.
Minister, your reaction to that father and son duo who were caught coming into Brisbane for the
Yes, so I understand the police have fined these individuals. I understand they had a valid pass to come in, but they were not entitled to attend the funeral, and that really concerns me because we have seen so many outbreaks at funerals across the country. It is putting not just yourself at risk, but everyone who attended that funeral. So I think it was very selfish, and it is unfortunate, but the police have fined those individuals. And it reminds us that it's not simply about do you have a valid pass to travel. This is about when you are granted a pass, you must comply with the directives that attach to that pass. If that requires you to isolate yourself, to not move around the community, not to go to public spaces, not attend funerals or weddings, you must comply with that.
Minister, what was your reaction to the New South Wales Premier's resignation yesterday?
Oh, look, I think it's sad to see. I think she did the right thing, but it is sad to see anyone in that position leave their career in that way. But they are serious allegations. This was a decision for her. She's made those decisions. So, I'll leave it to the people of New South Wales to weigh all that up.
Minister, a lot of Queenslanders are very obviously concerned about whether they'll be able to see family to stay for Christmas, and people have a bit of reassurance or any sort of answers around that.
Oh, look, if Queensland wants us to be open by Christmas, there's one thing that they have full control over, and that is getting vaccinated. If you love going out and spending time with family and friends, if you love going to the beach, if you love going on holidays, if you want to go see family and friends around the country, the best thing you can do and that you have full control of is getting vaccinated, and do it today. Don't wait.
And so will it be 80%? Would that be enough?
We've answered that time and time again. The 80% is just one element of the model, of the Doherty Institute modelling. It also depends on the level of outbreak that you have and whether it can be controlled, the impact that's going to have on your health systems, and what that still means for the unvaccinated population. So when you ask, is 80% enough, that is saying, is it okay that 20% of our population, potentially our most vulnerable parts of the population, our low socioeconomic areas, our areas of... sorry, Dr Young's going to help someone. Our Dr Young is always doing a wonderful job looking after our community, so she's just looking after a local constituent here. But it's that 20%, if we're looking at percentages and percentages alone, in every jurisdiction. It is saying that that 20%, that could be our remote Indigenous communities, that could be our low socioeconomic, it could be our multicultural communities that have a lower percentage of protection in their vaccination rates, that we're okay for them to have outbreaks. So we've got to look at all of it. I encourage anyone and everyone to look at the Doherty Institute modelling. They've put out some really simple information on social media to understand that modelling. But I understand National Cabinet are still doing more work on this. So we are there working with every state and territory and with the Commonwealth on this issue. We all want the same outcome. We all want our communities to open up, to do it safely, to be vaccinated, and so we can actually start enjoying all of the wonderful lifestyle that we've had previously. Thanks, everyone.
Thank you.